Nancy Scanlon Pharm D at Hunterdon Hematology Oncology, certified in cannabis medicine and healthcare. I'm here to talk to you about medical cannabis. So cannabis has been utilized for medicinal purposes for many centuries. Going back as far as 12,000 years ago, ancient artifacts have been noticed, and determined usage began as far back as 12,000 years ago in the Middle East. China published the world's first pharmacopoeia that included cannabis for rheumatism, pain, and sleep. There are documentations in Egypt that it was used for glaucoma and pain. And India has documented usage for diarrhea, anxiety, appetite stimulation, and pain. It's been used for medicinal purposes for many, many years. In 1939, a doctor by the name of William O'Shaughnessy introduced cannabis to Western medicine and initiated the first world clinical trial for cannabis. The studies proved successful in treating patients with headache, rheumatism, convulsions, nausea, and vomiting. In 1950, cannabis was published in the United States Pharmacopoeia. In 1992, Dr. William Offler's The Principles and Practice of Medicine recommended cannabis as the primary treatment and prevention against migraine. This became the first textbook of modern medicine. In 1899, the discovery of aspirin led to a decrease of cannabis. In 1914, they were using so much cannabis, the Boylan Act was created, and that was requiring written prescriptions and prescriber verification for prescriptions for cannabis. At this time, the United States was producing around 60,000 pounds of cannabis per year to supply pharmacies. In the early 1900s, it was the start of the Mexican Revolution. Mexican immigrants were coming to the United States with their recreational customs of cannabis, and anti-immigrant sentiment was common, and cannabis became a symbol for the intolerance against the Mexican immigrants. One of the reasons why we no longer use the term marijuana and we prefer to use the word cannabis. In the 30s, Henry Anslinger was appointed as the commissioner for the Federal Bureau of Narcotics. Cannabis was being targeted with articles being published stating marijuana, perhaps the most insidious of our narcotics, is a direct byproduct of unrestricted Mexican immigration. By 1942, that anti-Mexican sentiment was rampant, and they removed cannabis completely from the United States Pharmacopoeia and made it scheduled as a Class 1 narcotic, which shows that there is no medical benefit whatsoever for it, which we do know is untrue. So cannabis today, we've come quite a long way since the 30s. We've come quite a long way since the 60s. Cannabis is not what you think it was back in your childhood days. It's completely different. Currently, there are 38 states, 3 territories in the District of Columbia that allow the medicinal use of cannabis products, and 22 states, 2 territories in the District of Columbia have enacted measures to regulate cannabis for adult, non-medical use or recreational use. So the cannabis plants seems like a simple plant. It's part of the Cannabinaceae family and has an extensive history of use for medical and recreational purposes, as we discussed. However, it also has a rich history of its fibers being used for paper, clothing, fuel, and food. The cannabis plant contains more than 400 molecules, and approximately 100 of those molecules are cannabinoids. And cannabinoids are what take effect on our body. And it also contains numerous other chemicals, including things called terpenes. And terpenes are what give it its characteristic scent, taste, smell. Marijuana or cannabis is referred to the dried leaf, the flowers, the stems, the seeds from the Cannabis sativa or Cannabis indica plant. It contains psychoactive compound THC and also a non-psychoactive compound called CBD. THC, which is the psychoactive component of cannabis, is also known as sulfur-9 tetrahydrocannabinol. And this is what gives the psychoactive ceiling of cannabis when used at larger doses. CBD, or cannabidiol, is the non-psychoactive component of the cannabis plant. And this is derived from hemp and non-hemp plants. Hemp is defined as the part of the cannabis sativa plant with no more than 0.3% of THC in that plant, which is not enough to cause any psychoactive healing whatsoever. Now, terpenes, as I mentioned previously, go hand in hand with the cannabis plants. There are naturally occurring compounds found in the plant that make the certain strains smell or taste different from another, and they have also been found to have many therapeutic benefits. So specifically THC, again, is responsible for the way your brain and body respond to cannabis. This includes its intoxicating feeling, the psychoactivity feeling, and it's very effective with helping nausea, appetite, anxiety, pain. However, it's most effective with the nausea, sleep, and pain, especially when you're looking at strains that are more in the indica family. And we will touch on that in just a few moments. Sativas, so the cannabis plant, it can really be THC plant, can be a sativa strain or an indica strain. Sativa strains are more for your daytime. And if you want to think of word associations, sativa, it starts with an X, it's sunny in the daytime. If you think word association, sativa, sunshine, you know that's what you're going to want for the daytime. And those have been used for more focused, energizing, and creative effects. They're great for nausea and appetite stimulation during the day. And they do have a good amount of properties for depression and anxiety. Your indicas, if you think indigo blue, it's really dark blue and it's dark at night. You can remember indica goes at night. And that's more for the nighttime use, and it has effects of drowsiness, relaxation. It also has muscle relaxant properties to it. They're great for helping with sleep and pain and anxiety, and they can make you a little more mellow, introspective, and relaxed. Now, you can get combinations of them called hybrids. You can have a hybrid of 2 sativas, a hybrid of 2 indicas, or a hybrid that's a little bit of both. And those can be, once you've gotten into using cannabis a little more frequently and you've decided which strains work best for you, you can start to look at things like a hybrid. So how does it actually work? How does THC affect our body? So THC works by affecting the cannabinoid receptors on our endocannabinoid system. So it's kind of surprising to know we have these receptors in our body that are receptive to cannabis. We hadn't known this for a long time. Now that we're allowed to research it, we're finding that it's very interesting that that's the only receptors cannabis attaches to. But the endocannabinoid system contains 2 receptors. You have your CB1 or cannabinoid 1 receptors, which are in your central and periphery nervous system. And those are most abundant in your brain. They're very widely distributed through your body. They mainly deal with muscle spasticity, insomnia, nausea, anorexia, pain, and inflammation. They are localized in the same place that our opioid receptors are found. However, opioids do not respond to the CB receptors. They only respond to opioid receptors. And this is why you cannot have any sort of overdose on cannabis. You can overdose on opioids, but you cannot overdose on cannabis. CB2 receptors, those are in your peripheral and your immune system. And they're mostly on the immune cells. So when the CB2 receptor is activated, this will decrease the activators of the immune response and decrease the inflammatory process. So a lot of times if you have a topical, you have muscle aches and pain, a topical product will really help with that and help reduce that inflammation. So CBD, how's that going to work for us? So CBD is the non-psychoactive part of the cannabis plant, and it's shown to have many benefits as well for anxiety, psychosis, drug dependence, inflammation, pain, and seizures. It has some diverse therapeutic effects, and it really does so by acting on a lot of different receptors. These are not going to react to your typical receptors, your cannabinoid receptors, but they react on a lot of other receptors in our body. our serotonin receptors, which are responsible for anxiety and depression, our GABA receptors, which are also help reduce anxiety. We have the TRPE1 or vanilloid receptor, and those really help with pain perception, inflammation, and body temperature regulation, similar to something like a capsaicin cream, where you have that, it attacks those receptors and helps with that pain relief. And then you have the TPAR gamma receptor. And those really do a lot with the development of Alzheimer's. It helps with those amyloid plaques and helps them not form as green. However, most often CBD interacts with other drugs via our liver metabolism. And that's where most of our drugs are primarily metabolized. So you have all these different pathways that the CBD can interact with. Now I've talked about terpenes. So what really are terpenes? These are the aromatic compounds that determine the scent of many flowers and herbs. Cannabis, with its distinctive odor and contributes to its flavor. Research suggests that some terpenes could have potential benefits for mental health conditions, including anxiety, depression, and insomnia. Terpenes also hold a diverse function as a plant and can produce a range of therapeutic and mood-altering effects for the cannabis consumers. Terpenes can promote pain relieving, anti-inflammation, and sedating activity. And a lot of times these terpenes will go hand in hand with either your sativa. We'll see more sativas that have a limonene or a pinene terpene in it, or your indicas for nighttime. We're going to see more of a linalool or a myrcene terpene. Now, terpenes aren't the be-all, end-all, but they do go hand in hand. And to go on to talk about more about the terpenes would be a whole nother hour of discussion. So we're just going to talk on that subject very lightly. So myrcene is the most common terpene found in cannabis, and strains with high levels of myrcene are usually your indica. The sedative effects making it a popular choice for pain relief and for sleep. The limonene is one of the most commonly found terpenes, and strains with high levels of limonene are usually sativas and have many potential health benefits, including anti-inflammatory, antioxidants, antifungal, and antibacterial properties. It is also shown to reduce stress and promote relaxation without becoming drowsy. Linalool is another type of terpene that can help with relaxation and alleviate stress. It actually has the same smell and fragrance as lavender. Lavender is one of the bigger things to use for stress relief and for sleep. So this note will help with relaxation and alleviate sleep stress. And it has some anxiolytic properties for patients suffering with arthritis, depression, seizures, insomnia, and cancer have also found aid in disease terpenes. Garofalene is a spicy and peppery terpene that you would really see in cloves and rosemary and hops. This terpene binds directly to the body's CB2 receptors, and it really does a great job of regulating inflammation and pain. And pinene, as the name suggests, has a piney, woodsy smell. Pinene terpenes are great anti-inflammatories and are often used to treat arthritis and other inflammatory conditions. They also have some bronchodilating properties, and it makes them helpful in treating respiratory diseases such as asthma and bronchitis. The one thing that is very difficult is when you're looking at product selection. You can't pick out your product based on terpenes. You can look at the product and see what terpenes are in it, and that can help you with your product selection. But it would be really great if you could say, I want something that has these 3 terpenes only in it, but they haven't gotten to that part of development yet. So when these growers are making their strain, they look at things like that and try to make a strain that has these select properties to it, but we're still getting there. This is just a picture of what the terpene, a small section of what our terpenes are. And as you can see, with the bolo, you have anti-inflammatory, anti-irritant, antimicrobial. The pinene is your antidepressant, anti-inflammatory, antimicrobial. They all have a little specific niche of what they can do within that cannabis plant for the patient. And there are synthetic cannabis medications. So as we said, cannabis is delta-9 tetrahydrocannabinol. You'll see signs out there for Delta 8, Delta 8 synthetics. It's dangerous. I don't recommend people trying it. It's something that you can just buy at a gas station, which should make you a little nervous to begin with. However, there are things out there called Marinol, which is a prescription. It's FDA-approved medication, which is a synthetic version of THC in a capsule. Now, Marinol contains one cannabinoid, where the cannabis plant, as I was saying before, contains hundreds of cannabinoids. And each cannabinoid has a different effect on the body. And this is how cannabis products can help with many different medical conditions. While Marinol only contains one cannabinoid, therefore it doesn't have the same full effect as the cannabis plant. You kind of need all those cannabinoids to work together to get kind of a synergistic effect where they're all working together to help within the body. When you only have one on its own, it really doesn't do the job. Epidiolex is another FDA-approved medication for the treatment of seizures. Very rare to find it in the US, it is more popular in Europe. So why use medical cannabis? What are our goals of therapy? Why are people looking at using cannabis? There's a lot of reasons, but the top 5 that I usually see are nausea, appetite, sleep, depression, anxiety, and pain. I have a great story to share with you about a patient that we've got on the medical cannabis program. And this patient had been losing weight, did not have an appetite, and was concerned. So we recommended this as a therapy. A couple weeks later, this patient comes in and asks to speak with me. Gave me the biggest smile. Says, I ate half of this sub today and held up half a sub. I've gained 5 pounds within the last 10 days because they hadn't been eating, they had been losing weight. However, they were so happy that their appetite has been a little bit better. They were able to keep that food down. They were able to keep that nauseousness at bay just by using a little bit of cannabis before meal. And it made the biggest difference for this patient. One of my happiest stories, you know, when I saw that patient smile and think, I ate half this stuff today. It was a beautiful thing. So it really is one of the only anti-nausea treatments that can also increase your appetite. You think you're nauseous, you gotta take care of that nausea first. This can also help spike that appetite a little bit. It also can have some meaning benefits for people who are struggling to maintain a healthy weight due to nausea or appetite changes. It'll definitely help stimulate that satiety part of your brain and say, oh, you know what, I could go ahead and eat a little bit more of that, or that does taste good. Let me try some of that. Sleep, it is a great thing for sleep. It really helps get you into that deep sleep range where you're not just kind of dozing. So usually an indica and outlet a little bit before bedtime, depending on which form you choose to use, it really does help you get that sleep. Some of our edibles can last 8 hours in the system. So if you can take that before bed and get a full night's sleep, that is a really good goal. Anxiety and depression. Research has shown that studies participants who begin using medical cannabis in a follow-up period saw reductions in both depression and anxiety. And for pain, cannabis and cannabinoids may be effective for treating some types of chronic pain, including neuropathy. It also has a reduction in opioid use, improved quality of life, and fewer medication side effects. So we're all taking some kind of medicine, but what does cannabis interact with? Everything interacts with everything, so this must interact with a few things. It really doesn't interact with a lot, and that's a really amazing thing. Cannabis is primarily metabolized through your liver. And when drugs that are metabolized via the liver, when they interact with cannabis, which there's just a few, it may result in increased blood levels of these drugs, which can lead to an increase in potential toxic side effects. Both cannabinoids and grapefruit molecules interact with a group of liver enzymes that belong to the cytochrome P450 family. So things that should not be taken with grapefruit or Seville oranges should not be taken with medical cannabis. But that's not an absolute. They shouldn't be taken together primarily. Warfarin is the biggest drug interaction that cannabis has. Cannabis can cause your INR, or your international ionized ratio, which is how we measure how your blood clots. It can cause that to raise quite a bit. So if you're on a medication called warfarin or Coumadin, it is not recommended that you be on medical cannabis. When warfarin and THC are combining for this enzyme to metabolize it, the warfarin level can rise, and that can increase your chance of bleeding. And this can increase visits to the emergency room. Patients who are taking warfarin should have their blood INR level tested prior to using a THC product and afterward. They should have more testing. There are safe alternatives to warfarin, such as drugs like Eliquis or Xarelto. These do not interact with THC and therefore are a much safer choice for an anticoagulant. Some additional drug interactions to consider: if you're a diabetic, THC can make some people more sensitive to insulin and can make your low or high blood sugars feel more severe. Heart disease, THC can cause temporary changes in blood pressure, sometimes causing it to rise immediately after consumption, and sometimes it can cause a lowering of blood pressure on other occasions. Corticosteroids, something like prednisone, they can depress the immune system, and too much leading to an increase in the patient's risk of developing an infection. Now, CBD and drug interactions. CBD has a little bit more drug interactions because of its metabolism through our cytochrome 2D6 and 3A4 system. And it can affect how drugs work and affect our bodies by reducing their efficacy or metabolism, making those drugs more dangerous. And this includes therapy and other medications. CBD has the potential to affect the metabolism of immunosuppressants and chemotherapy via liver metabolism, which may result in increased blood levels of these drugs and an increase in potential toxic side effects. So while you're on active therapy, we do recommend not using any CBD products, only a THC-containing product. There are many ways to use cannabis these days. It's not just the traditional smoking flower that we all grew up with. They now come in forms of drop or tincture, edible, inhalations, and cream. So inhalation, we don't necessarily recommend inhalation to our patients. Everybody has their own choice and the way they would like to do it. For our patients, we do recommend more of the edible or the tincture methods. However, to be thorough and consistent, we included inhalation on this. So when you smoke cannabis, the THC is carried from your lungs into your bloodstream, and from there it reaches your brain and the rest of your body to provide relief pretty quickly. Smoking cannabis is the fastest way to get it into your body, and it takes effect quickly within 1 to 5 minutes. The effect of inhaled cannabis on some are the most short-lived, with the effect lasting up to 1 to 3 hours. Cannabis can be inhaled through several different methods: smoking pre-rolled cannabis cigarettes, vaporization through a vape pen, and through water pipes. Now, edibles are a much safer option, but they do last in your system a very long time. So you do want to make sure that you're comfortable with the effects of cannabis before trying an edible. When you take cannabis orally, it will travel through your digestion. It's broken down in your stomach, which after your intestines absorb the THC, it releases it into your bloodstream. The edibles can take anywhere from 30 minutes to 2 hours to kick in. In fact, it can take up to 4 hours for you to feel the full effect of the edible, and those effects can last anywhere from 9 to 12 hours. A lot of times, if you take an edible on a full stomach, it's going to cause that absorption to be a lot lower than when you take it on an empty stomach. A lot of times, when we hear about people being in the emergency room because they've taken too much cannabis, it's because they've eaten an edible and they're not thinking it's working. And a lot of times they'll take another one, and then you're going to get into trouble at that point. The rule of thumb is as soon as you've tried it and you're saying this is not working for me, give it another 15 minutes. because that's when it's going to kick in. So give it a good go, and then you'll feel the effect. And overdoses are much significantly more common with edibles than they are with any other form of cannabis. When trying an edible for the first time, it is very important you start with a quarter of the dose. Each edible is roughly around 10 milligrams. And what we really encourage our patients is to quarter those gummies and start with 2.5 milligrams and then work your way up to that in a couple of days. You don't want to go up in a dose. You want to give yourself at least 3 days on a dose before you decide to up that dose. And many patients find that edibles provide the longest nighttime relief, and they can be consumed within an hour prior to a patient's desired bedtime. We also have liquids, often under tincture. And the liquids and tincture go into effect almost immediately after you take them, but their effects also fade a lot more quickly. Tinctures have a relatively fast onset within 30 minutes and can offer a moderately long-lasting relief, sometimes up to 3 hours. They are easy to dose and titrate, and they always come with a 1 milliliter dosing dropper that you can customize how many drops you give per dose. They can be mixed into food, placed under the tongue, in between the cheek. You can apply them topically. There's a diverse way you can use them and customize the tincture to make it very useful for the way you like to use it. How do we determine our dose? It's not like when we go to a doctor and they write you a prescription and they say, okay, take 1 pill once a day. It really doesn't work like that. It's very individual dependent. We're all as individual as our thumbprints, and the way we're going to be able to metabolize and tolerate medical cannabis is the same. So if you haven't used it before, or it's been a very long time since you've tried it, you always want to start with a very low dose and titrate up slowly. The minimum effective dose is the dose that achieves the desired effect. So what we're talking about with our patients are really micro doses. We're not talking about doses that are going to, leave you stuck on the couch, not wanting to do anything, falling asleep. We are talking about doses that are very micro doses that are just going to give you that little bit of effect that makes that nausea go away, or increases your appetite, or helps you get that sleep. So in order to get that lowest therapeutic dose that allows the patient to experience a positive result while minimizing the negative effects, we do recommend starting slow and keeping a journal about what you're using. Write down what product you use, the date, the time, how much you use, and what effect did it give you. I started taking let's say you're taking a watermelon gummy at bedtime. You ordered it, you took it at 9 o'clock, you didn't feel anything at 10:30, you still went to sleep, didn't really sleep that great. So you document that. This didn't seem to really work too well for me. So try it for a day or two. Then maybe about day 3 or day 4, all right, let me try a half and see where you go with that. And see if I did feel that effect within an hour. And I don't remember when I fell asleep, but I fell asleep and I slept through the full night. So keeping a journal and documenting what you've tried and how it has made you feel is really valuable for you to know what products work well for you and what products don't. Every couple of days, you can increase your dose until you get to that dose that's actually giving you the benefit that you need. But once you've gotten to that dose, it is recommended that you stay there. Because if you do get a little too much and overconsume, it can be a little uncomfortable. And we'll talk about that in just a moment. And our goal is to really get our symptomatic relief without any side effects. You don't want the dizziness, the drowsiness, the grogginess. We're not looking for any sort of side effects like that. We just want that minimum dose to make you feel like, okay, I can go out and go do this today. I can take care of this, or I can go eat that today. So if we overconsume and we take too much, it can put us into a really uncomfortable place. And they can be mild. They can be things that include a rapid heartbeat, dry mouth, red eyes, dizziness. Some people get a little anxiety from it. Some people get a little, lethargic, or they get couch lock, or they just don't want to get out of their chair and they just want to sit. They can also be pretty severe, including things like paranoia, difficulty standing or walking. Some people have said, I feel like I'm dying, and difficulty remaining conscious. And that just means just falling asleep. There are no receptors, cannabinoid receptors in our breathing center. So it's something that you would never stop breathing from. It's something that you will never not wake up from. It is safe and effective to use. These side effects, when you've overconsumed, are transient and they can last 4 to 6 hours, depending on the what you use. If it's an edible, it's going to last a lot longer. It's a withdrawal, it's going to be a lot shorter. But the best thing you can do is stay in a safe, comfortable place, stay hydrated, avoid caffeine and alcohol, just work on your breathing, take deep breaths. And the best thing to do is to just sleep it off. But make sure you have somebody that's around with you just to make sure you stay comfortable. There have been no deaths from overdose from marijuana have ever been reported. So when I was talking about journaling, it is very important to keep a log of what you're using, what works for you, what doesn't work for you, so you can take it to your dispensary and say, this is what works for me, this didn't work for me, this is the dosage that I'm looking for, and they can really help you guide your therapy with that. So the New Jersey Medical Cannabis Program. The New Jersey Medical Cannabis Program, previously was named the Medicinal Marijuana Program, has helped registered patients under the care of a licensed healthcare practitioner safely access cannabis-based medicine from regulated and monitored facilities. As a part of medicinal treatments, patients receive cannabis orders from their doctor or other healthcare practitioners for up to a max of 84 grams for every 30-day period. That is quite a lot. Usually we see our patients go through about 28 grams or 1 ounce for a 30-day period. Cannabis orders are pulled at one of the state licensed alternative treatment centers, or ATC, or dispensaries across New Jersey. And to become a registered patient with the New Jersey Cannabis Program, you must have a relationship with a healthcare practitioner who has an ongoing responsibility for the assessment, care, and treatment of a patient's qualifying medical condition. You need to be a New Jersey resident, and you must be diagnosed with a qualifying medical condition by a New Jersey healthcare practitioner registered with the state cannabis registry. The approved qualifying medical conditions currently are ALS, anxiety, cancer, chronic pain, dysmenorrhea, glaucoma, irritable bowel, including Crohn's disease, paratracheal skeletal muscular spasticity, migraine, multiple sclerosis, muscular dystrophy, opioid use disorder, HIV and AIDS, PTSD, seizure disorders including epilepsy, terminal illness with prognosis of less than 12 months, and Tourette's. So you have to set up an account. Once your prescriber has said, we're going to sign you up for the medical cannabis program, there are a few steps that you need to take. You need to create a patient account on the medical cannabis program. And once your account is set up, and you will be able to track your application status, check on your authorization periods, pay for your ID card, and select your dispensing center. And basically what's included is when you get the paperwork that gives you your registry and your reference ID number, and you log into the website, it's going to ask you for a few things. You're going to need those reference numbers and registry ID numbers from the prescriber. It is then going to ask you for a valid email. Once you get that email in, it's going to send you a code to verify your email. We will verify your email, and then you can set up a security question and password. Once you've gone past those steps, then you can go and actually create the account. You can select your dispensary, and you're only allowed to pick one dispensary at a time. If you decide that the one you've been going to doesn't have the products you like and you don't want to go there, you can always go to another dispensary, but you need to change that affiliation online before you go. You also need to take a picture, which would be like a passport picture from the shoulder up, no glasses, no hat, no mask, against a plain white background. And they do require a picture of your driver's license. Once you have that all uploaded and you submit that to them, they will send you a link for payment after they reviewed everything. Make sure you check your spam folder. They can send you that verification, that email verification code, and that goes to your regular email, but it seems that when they send you for the payments, that always goes into your spam email. So always make sure you check your spam email. Once you've paid for your fee, usually it's about $50 for every 2 years for the physical card, then they will send you that card in the mail. They'll say it can take up to 4 weeks, but I've never seen it take more than 10 days. Once you have that card in hand, you can go to your dispensary of choice. And when you go there, the people are really very knowledgeable about their product. And you can have very good conversations with them and let them know, I am a medical patient. I am looking at something for sleep or for appetite, and they can really help direct you to that. I skipped a slide. I went through this one already for you. So once you've all set up, and again, the application is at $50 for every 2 years, you do get a discounted of $20 every 2 years if you qualify as a senior citizen over the age of 65, if you have Social Security benefits, if you're a military veteran, and a few other things that are on there. They give you a whole list that you can verify with them. And then once the payment is received, your card will be mailed to your address that is on record. The card is good for 2 years. Depending on who your prescriber is, they can either do your prescription for 3 months, 6 months to a year. Our practice, we do 1 month. We do 1 ounce every month for 3 months at a time, and then we renew it at the patient's request. So what are the patient's responsibilities? Now that you're a medical, what kind of responsibilities are bestowed on patients? Well, one of the things that you always want, if you're traveling, you always want to make sure you keep your proper identification, keep your medical cannabis card with you at all times. Keep it in its original packaging. Don't put it in another package and carry it with you. Keep it in that original packaging that has your prescription label on it. And it's not a prescription label like you would get at a local pharmacy. It's just going to have a little sticker that has your name and your registry ID number on it, and that they attach it to the bottle. And really, it's really encouraged to keep your products at home. However, if you are traveling, make sure you keep that packed away. Keep a copy of your card with whatever you have packed away, because if you wind up, somebody goes through your luggage at the airport, they see this product, they'll see a copy of your medical ID card, and they will not come with that. You also need to keep in mind that the smell of cannabis to attract law enforcement and attention, and not share it with anybody, and not smoke. Well, really, they're talking about like smoking. You don't have to worry about that if you're doing edibles or tinctures, but if you do choose to smoke, do not do it on federal land or around federal buildings. Do not smoke in private vehicles that are in motion. They're all kind of a little self-aware. You would know that things that you don't want to do that. You don't want to really transport medicinal cannabis across state lines. Some states don't have any of these programs. They might not have recreational, and only 3 don't have medical. So if you are traveling and you're traveling with your medical cannabis, please check those local states to see what their regulations are. And that's what I have for you on the medicinal cannabis program. Thank you so much for attending tonight. I appreciate you guys coming in and learning about it. And do you have any questions? Yes, sir.
I've had to run out to the bathroom. Okay. I'm just one part of prednisone. I take prednisone.
So,
can you just touch on that?
Sure, absolutely. So prednisone is a steroid, and the prednisone can at times reduce our immune, like it can suppress our immune system a little bit. And so sometimes using prednisone with something like cannabis, they can kind of work hand in hand and kind of deplete that immune system a little bit. And you can be more susceptible to catching an infection or a cold. But you do want to make sure that if you're on high doses of prednisone, you really kind of look at what you're using the medicinal cannabis for. You can take them together, but just knowing that the prednisone tends to like reduce the immune system's efficacy a little bit, you do just want to be careful when you're taking things like that and taking extra precautions to make sure you don't get colds or get viruses.
Interesting. You mentioned the CB1 and CB2 receptor,
Correct.
right? I think it was the CB1 with serotonin, right? Where we get our feel good, right?
So there's a serotonin receptor that is
Yeah.
separate from the CB1 receptor.
Okay.
The serotonin receptors those are activated by more CBD versus THC. It's a little confusing because you have CBD, the thing would go with the
Yeah.
CB1 receptor, but they do work with other receptors. Only THC works with the CB1 and CB2 receptors.
So like when it comes to like drug interactions, I work with a lot of clients that take SSRIs, SNRIs, benzodiazepines. I mean, like if they're considering this or taking it in conjunction with the psychotropic meds, like
With something like an SSRI, it's not so much of a problem unless they were taking something with CBD. However, with a benzodiazepine, I would be a little concerned with, taking them both because now you're going to increase that sedative effects. And increasing that sedative effects, benzodiazepines can really trigger the respiratory center where THC doesn't. So I would say if somebody's taking a benzo, it would be one or the other. I would not take both.
I'm actually really surprised major depressive disorder is not on that list.
I am too. And New Jersey is one of the states that has one of the most stringent requirements. Other states do have things like that.
Yeah.
If you go up to states like Vermont and Maine and California and Oregon, their qualifying conditions are quite more comprehensive than what New Jersey's is. New Jersey, I'm happy to say that they're on the bandwagon and they're allowing this for our patients, but in all honesty, they don't give as many of the qualifying conditions as they should.
Would this also be considered okay to like prescribe or recommend rather for someone with like disordered eating?
Yeah, absolutely. Especially if we're talking with somebody that has like anorexia or has food aversion. That would be something that a very low dose of a THC containing product would be a really great thing for them.
Okay.
They can also email me if they have a question. Yes, sir.
If you're on Lupron and other medications for lung cancer, is there any certain benefits to cannabis for that? Because the Lupron, my cancer, prostate cancer, has gotten used to not these change and put me on for 250 milligram pills a day, prednisone. What would be better? And I just got localized in the south lung cancer. Pardon?
Well, a lot of times what this can do is can really help with the way you're feeling. Especially with taking high doses of medications, they can cause a lot of arthralgia, they can cause stomach discomfort, they can cause things along those natures, and definitely the cannabis can help with that. It's not going to interact with your medication, and it's also not going to necessarily make it work any better with that. So I know I'm feeling I know exactly which medication you're talking about, but it's not going to interact with that. But with some of the side effects that you can get with some of these medications, it will help with those side effects, especially with the digestive system side effects.
Yep. Sorry, I just thought about that. How do we find a provider right? Like that is specifically registered to get that.
That is a very good question. I'm glad you asked that. So you can go to the New Jersey Cannabis website, and there is a link to find a provider.
Okay.
And they have qualified providers on there where you can go and you can look and see if there's a provider in your area. There are a number of providers, I know in Hunterdon County, not just specific to Hunterdon Medical Center. There are other providers out there. At least I know there have been. I don't know if they've maintained their license, but you can go to those websites and find them. There are some sites that are out there. I know there's a holistic center in Raritan. It is very expensive to go to, but you can go to these holistic centers as well. And it's almost, you do get seen, you do get looked at by a physician, but they do charge you. It's a cash only. And that's the other thing. Currently, marijuana is still considered a Schedule 1. However, they are lessening that in the spring to a Schedule 3, to my understanding. So at least they're just classified as a controlled substance. However, some of these holistic centers, you can go and one of our patients told us it was about like $300 or $400 to get the prescription, and then you have to go back every year for that. So it's pretty expensive to go to these centers. However, if you can find a qualifying physician that does prescribe, I would definitely get a relationship with that physician.
Yeah. Would they be like coordinate care at
They
all?
do not. That's the other thing.
Why?
I know. I know.
It's important.
That's why I highly recommend finding a physician
All right.
that you can see on a semi-regular basis, maybe twice a year, or, until you get ready with, get set with your therapy, that you can work on that coordination of care, work on that product selection, talk to the patient about what they're going through. Some of these places are set up that you just sign a card and off you go. And they don't give you any advice, which I don't necessarily recommend places like that.
Yeah, it's like I would hate to recommend my clients to go somewhere where then I'm treating them, but then also like someone else is treating them on the same thing.
I do feel that a patient who is interested in medical cannabis does need to have that good relationship with their provider, and that provider is part of that medical cannabis registry. It's so important because if you're looking at for medicinal purposes, you need to have that relationship with that provider, that physician, and be able to talk to somebody who is experienced in it.
Yeah. Thank you.
Can you go to your cancer doctor that you had now and then they recommend somebody to get on the website to the process started?
Absolutely. If your physician is part of the register, is registered with the state, and you can have that conversation with them and have an open conversation when you see your prescriber. Say, look, I'm really interested in thinking about the medical cannabis. What are your thoughts? And I know when I speak with our patients, my first question is, what are your goals with therapy? What are you looking, what are your goals with trying it? And we have a great open conversation about it. It's very interesting to see that, a lot of it is, I want to be able to sleep at night. I want my appetite back. I don't want to be nauseous. Those are our biggest three, concerns for our patients that are on these programs. But I would speak with your physician. If you're part of our practice, I would definitely speak with your physicians. If you're part of a different practice, I would ask them if they are registered prescribers. You're welcome. Yes. No. So you have to be a state resident and your prescriber has to be a New Jersey licensed prescriber in order to prescribe any sort of medical cannabis within the state of New Jersey. Yes. Yes, our prescribers are registered with the program. So we took it a little bit closer.
Yep. My liver took a little beating, the enzymes are up, and it's been about a year now. I expected to, because the carbohydrate in the liver, that create changes in the lab work and stuff.
That is a really good question. So far, we have not seen any changes in liver function enzymes.
Okay.
With none of our patients that have been on it. I cannot say never,
Right.
but in general, it does not change any of the properties of the liver enzyme.
Okay.
Yeah, so it could be safe.
Here's another question here. Are the current
Our genes are part of the program, yeah.
any other questions for virtual experience?
Well, thank you everyone for coming out tonight. Greatly appreciate it. If you have any questions, please feel free to.
Thank you.
Thank you.